Most of us have seen or cared for someone in a delirium. Perhaps you remember a patient in the ICU who became agitated and tried to pull out their tubing. Maybe you witnessed an older adult with a broken hip in the emergency department who repeatedly tried to get up from their stretcher despite their inability to walk. You may know of a community dwelling senior who wasn't eating or drinking properly, who became suddenly confused and no longer safe to stay living at home alone. You may recall a resident in a retirement or long-term care setting who is suddenly just not themselves, and you reported your concern. All of these situations offer us red flags or warnings to draw our attention. Consider delirium if this is a sudden onset and a change from their usual status. Is there a change in behavior, function, or mental status? If so, think delirium. Delirium is a common and devastating, yet often unrecognized condition in older adults. It is associated with poor outcomes, including falls, loss of function, cognitive decline, loss of autonomy, and premature admission to long-term care or retirement homes. In hospital, delirium can result in increased length of stay, which in turn exposes the person to even more risks, such as use of restraints, tethers such as IVs or catheters, potential infection, falls, constipation, pneumonia, and ultimately increased risk of death. Patients and families report significant distress, with patients describing their experience as full of fear, anxiety, hopelessness, and loneliness, with an overwhelming sense of feeling threatened. The distress and humiliation is made worse by their difficulty communicating. It's important for us to maintain a high index of suspicion and screen for delirium among persons at risk and when you are aware of sudden change from baseline. There are many tools that exist to help identify a potential delirium. One of those tools is the Confusion Assessment Method, also known as the CAM. The CAM is an algorithm used to screen for delirium that identifies key indicators including a sudden onset and fluctuating course, inattention, disorganized thinking, and altered level of consciousness, ranging from hyperactive to seemingly comatose. Clinicians trained to use the CAM should document and communicate their findings to the attending medical professional as soon as possible. Inform them of a positive CAM result. Consider using a communication tool, such as the S-bar, and follow up with a holistic assessment to identify possible causes. PIECES is a widely used assessment framework that can guide your assessment and care strategies. To identify the causes of delirium, you must explore underlying physical causes. Some of the most common causes of delirium, often described as the usual suspects, include medication or drugs, infections such as bladder or pneumonia, impaired kidney function, drug and alcohol withdrawal, and imbalances such as electrolytes. These are just a few of the common causes, most of which are treatable. Caregiving strategies include identifying and treating the underlying condition. Most importantly, seek to discontinue or reduce unnecessary medications or drugs known to be harmful for the elderly. Minimize the use of restraints or tethers, such as IVs, catheters, and bed rails. Promote early mobilization and implement a toileting routine. Ensure adequate fluid intake. Make sure the person has their glasses and hearing aids. Speak in a calm voice. Use simple language and gently remind them where they are. Use visual aids like clocks and calendars to promote orientation and reduce distress. It is important to be on the lookout for persons at risk of developing delirium in any setting. Risk factors for delirium include age, cognitive impairment, severe illness, multiple medications, sensory impairment, sleep deprivation, immobility, use of catheters, and a previous diagnosis of delirium. It is important to recognize the risk of delirium in older persons. Identify those at risk. Flag the risk or sudden change. Screen using a validated tool. Treat the underlying causes and symptoms. Apply caregiving strategies and interventions aimed at preventing delirium.